Top 20 Clinical Lab Tech Interview Questions and Answers. Discover the top 20 clinical lab technician interview questions and answers to help you prepare confidently, enhance your knowledge, showcase your skills, and succeed in your next lab tech interview. 1. What are the key responsibilities of a clinical lab technician? A clinical lab technician performs essential diagnostic testing on patient samples such as blood, urine, and tissue. Responsibilities include preparing specimens, operating lab equipment, and analyzing results. Technicians must ensure tests are accurate, timely, and meet quality standards. They document findings in laboratory information systems and may assist with specimen collection. A key responsibility is maintaining equipment through regular calibration and ensuring that safety and quality control protocols are followed. They must also stay current with advances in testing techniques and regulations, such as those from CLIA or CAP. Communication with physicians and other healthcare staff is vital for clarifying orders or reporting urgent results. Ultimately, lab technicians play a crucial role in patient care by providing data that supports diagnosis, treatment, and disease prevention. Their accuracy and efficiency directly impact clinical decision-making and patient outcomes, making their role both technical and vital in healthcare. 2. Can you explain the difference between qualitative and quantitative testing? Qualitative testing determines the presence or absence of a substance in a sample, providing a simple positive or negative result. For example, a pregnancy test indicates whether HCG is present in urine. It doesn't tell how much of the hormone is there, just if it exists. Quantitative testing, on the other hand, measures the exact amount or concentration of a substance, like the glucose level in blood. These tests provide numerical results, often with reference ranges, allowing clinicians to assess severity or monitor changes over time. Both types of testing are essential in diagnostics. Qualitative tests are often used for screening, while quantitative tests provide detailed data for diagnosis and monitoring treatment. As a clinical lab technician, it's important to know which tests are performed based on the clinical question, ensure proper calibration of instruments, and interpret results accurately to aid physicians in making informed decisions about patient care. 3. How do you ensure accuracy and precision in lab test results? Ensuring accuracy and precision in lab results requires strict adherence to standard operating procedures, regular calibration of instruments, and the use of control samples with each test batch. I start by verifying patient information and test orders to avoid clerical errors. During specimen processing, I follow protocols carefully, including using properly labeled tubes and correct volumes. I use quality control, QC, materials at the beginning and during testing runs to confirm instrument and reagents are functioning properly. If QC results fall outside acceptable ranges, I investigate and resolve the issue before proceeding. Repeating tests and comparing results with historical data helps validate accuracy. Documentation and double-checking are crucial steps. Participation in proficiency testing and following CLIA, CAP, and OSHA guidelines ensures ongoing compliance and competency. I also stay updated on new methodologies and undergo periodic training. Maintaining a clean and organized lab environment further supports consistent, reliable results. 4. What safety protocols do you follow when handling biohazardous materials? Handling biohazardous materials demands strict safety protocols to prevent contamination and exposure. I always use appropriate personal protective equipment, PPE, such as lab coats, glove, and eye protection. I work in designated biosafety cabinets when handling infectious materials and ensure all containers are clearly labeled as biohazards. Sharps are disposed of in puncture-resistant containers immediately after use. I disinfect work surfaces before and after procedures using approved disinfectants and follow standard precautions, treating all samples as potentially infectious. I'm trained in spill response procedures and know how to safely contain and clean biohazardous spills using kits and protective gear. I also follow waste segregation rules, disposing of infectious waste, chemical waste, and regular trash in their respective containers. Regular hand hygiene is practiced before and after glove use. I stay current on OSHA regulations and attend safety training sessions, ensuring both personal and environmental safety in the laboratory. 5. Describe your experience with common lab equipment, e.g., centrifuges, microscopes, pipettes, analyzers. I have extensive experience operating and maintaining standard laboratory equipment. With centrifuges, I follow proper balancing techniques and speed our time settings based on sample type, ensuring samples are separated efficiently and safely. I routinely clean rotors and check for where to avoid malfunctions. I use microscopes for examining stain slides such as blood smears and urine sediments, ensuring proper focus, light adjustment, and periodic calibration. Pipettes are essential for accurate measurements. I've been trained in proper pipetting techniques, including pre-wetting tips, consistent pressure, and regular calibration checks. For analyzers, hematology, chemistry, or immunoassay, I follow daily maintenance protocols, perform quality control runs, and troubleshoot errors based on error codes and logs. I'm also familiar with loading reagents, changing cuvettes, and updating software when necessary. My attention to detail and understanding of each instrument's function ensures smooth workflow and accurate results. I take pride in maintaining equipment to minimize downtime and maximize test reliability. 6. How do you perform and interpret a complete blood count, CBC? Performing a CBC involves collecting a venous blood sample in an EDTA tube to prevent clotting. The sample is then loaded into a hematology analyzer, which measures parameters such as red blood cells, RBC, white blood cells, WBC, hemoglobin, hematocrit, and platelets. I ensure the machine has passed quality control before running the test. After analysis, I review the data for any abnormal flags or results that require manual verification. For flag results, I may prepare and stain a peripheral blood smear to examine under a microscope for morphology. Interpretation involves comparing values to reference ranges and looking for clinical patterns, like high WBC indicating infection or low hemoglobin suggesting anemia. Critical values are immediately reported to physicians as per lab protocol. I document all findings and ensure results are accurately entered into the lab information system. Proper handling and timely processing are essential for reliable CBC results. 7. What steps do you take if a lab instrument malfunctions during testing? If a lab instrument malfunctions, I immediately stop using it to prevent invalid results. First, I review the error message or fault code to identify the issue. I check basic components, power supply, reagent levels, and waste containers for possible problems. If it's a minor issue, such as a jam or blockage, I follow the manufacturer's troubleshooting guidelines and perform necessary maintenance or resets. If the problem persists, I report it to the lab supervisor and contact technical support if required. Meanwhile, I switch to a backup instrument if available or reroute tests to another lab station. I document the malfunction, affected samples, and corrective actions in the instrument's maintenance log. For any samples processed before the error, I assess whether results are reliable or if retesting is necessary. My goal is to resolve the issue quickly, maintain workflow continuity, and ensure patient test results remain accurate and timely. 8. How familiar are you with CLIA, CAP, or OSHA regulations? I'm well versed in CLIA, Clinical Laboratory Improvement Amendments, CAP, College of American Pathologists, and OSHA, Occupational Safety and Health Administration, regulations. CLIA ensures quality lab testing and outlines standards of personnel, testing procedures, and quality control. CAP accreditation requires adherence to rigorous protocols and regular inspections, which I help prepare for by maintaining proper documentation and equipment logs. OSHA guidelines govern workplace safety, including hazard communication, proper PPE use, and handling biohazards. I actively participate in training and audits to ensure compliance. Following these standards helps guarantee accurate test results, patient safety, and a safe working environment for all lab personnel. 9. What is your experience with automated versus manual testing methods? I have experience with both automated and manual testing. Automated methods, like using hematology and chemistry analyzers, provide high throughput, speed, and consistency, which is ideal for routine tests. I ensure these systems are regularly maintained and calibrated. However, I also perform manual techniques when required, such as gram staining, cell counts using a hemocytometer, or microscopic urine analysis. Manual methods require greater attention to technique and interpretation, especially for abnormal or rare findings. I understand when to choose manual testing over automation, For example, confirming flag results or performing specialized tests, ensuring accuracy and thoroughness in the diagnostic process. 10. How do you handle and store sensitive specimens, e.g., blood, urine, tissue samples? Handling and storing sensitive specimens requires strict adherence to protocols. I ensure specimens are properly labeled with patient information and time-stamped. Blood and urine samples are stored at specified temperatures, usually refrigerated if not tested immediately, while tissue samples may require fixatives like formalin. I use leak-proof containers and transport them in biohazard bags, minimizing exposure and contamination. Chain of custody documentation is maintained when needed. I also track sample stability times to prevent degradation and ensure timely analysis. Specimens are logged, tracked in the lab information system, and disposed of according to biohazard protocols. This careful handling preserves specimen integrity and ensures valid results. 11. Describe a time when you encountered an abnormal lab result. How did you handle it? Once, while performing a CBC, I observed an unusually high white blood cell count and immature cells flagged by the analyzer. I reviewed the quality control data to ensure instrument accuracy, then prepared a peripheral smear. Under the microscope, I confirmed the presence of blast cells, which are indicative of a possible leukemia diagnosis. I immediately repeated the test to rule out specimen error and confirmed the same result. I documented all findings and quickly alerted the pathologist and attending physician, emphasizing the urgency. My swift and accurate response ensured the patient received timely evaluation and care. Accuracy and communication were critical in that situation. 12. How do you prioritize tasks when multiple tests need to be processed urgently? When managing multiple urgent tests, I prioritize based on clinical urgency, specimen stability, and test turnaround times. Emergency or stat orders always take precedence, followed by time-sensitive specimens like coagulation profiles. I quickly assess which tests require immediate attention and organize my workflow accordingly. I communicate with the clinical team if delays arise and update them on estimated times. If possible, I delegate routine or less urgent tasks to team members. Using a lab information system helps track priorities and deadlines efficiently. Staying calm, focused, and organized allows me to manage workload effectively while ensuring critical results are delivered promptly. 13. What would you do if you notice a colleague not following proper lab safety procedures? If I observe a colleague violating lab safety protocols, such as not wearing PPE or mishandling biohazards, I would address the issue calmly and immediately. I'd remind them of the correct procedure and explain the potential risk to themselves and others. If the behavior continued or was severe, I'd document the incident and report it to the lab supervisor or safety officer as per protocol. Lab safety is a shared responsibility, and maintaining a culture of accountability is essential. I'd also suggest retraining if necessary. Prompt, respectful intervention helps prevent accidents and reinforces a commitment to a safe working environment. 14. Tell me about a time you made a mistake in the lab. How did you correct it? During one shift, I mislabeled a blood sample due to a distraction during specimen collection. I quickly realized the error while cross-checking patient identifiers before running the test. I immediately stopped processing, informed my supervisor, and followed incident reporting procedures. I notified the appropriate staff to recollect the sample and documented the error in our lab system. To prevent future mistakes, I double-checked labels with a requisition form and adopted a read-back protocol during labeling. This experience taught me the critical importance of focus and verification, especially in a high-stakes environment where even small errors can impact patient care. 15. How do you handle working under pressure, especially during high-volume testing periods? I handle pressure by staying organized, focused, and maintaining a calm demeanor. During high-volume periods, I prioritize tasks based on urgency and test complexity. I break tasks into manageable steps, rely on the lab information system to track workflow, and ensure I'm using time efficiently. I remain flexible, support team collaboration, and communicate with colleagues to balance workload. If equipment issues or backlogs arise, I escalate problems appropriately while maintaining accuracy. I also take short mental breaks to avoid fatigue. My ability to stay composed and methodical ensures I maintain high-quality results even under demanding conditions. 16. How do you communicate critical lab findings to physicians or nurses? When critical lab findings are detected, such as extremely high potassium or low hemoglobin levels, I immediately verify the result by reviewing quality control and, if needed, repeating the test. Once confirmed, I follow the lab protocol for critical value reporting, which typically involves direct phone communication. I clearly state the patient's name, ID, test result, and why it's critical. I document the time, recipient's name, and details of the conversation in the lab information system. I speak concisely and ensure the recipient fully understands the urgency. Prompt and clear communication is vital, as these results often require immediate clinical action to ensure patient safety. 17. Describe your experience working in a team-based lab environment. I have extensive experience working in team-based lab settings where collaboration and communication are essential. In my previous roles, I coordinated with colleagues to balance workloads, cover shifts, and ensure timely test processing. I believe in open communication and supporting team members, especially during busy or stressful times. For example, when equipment failed during a shift, my team and I redistributed tasks, supported troubleshooting, and met our deadlines together. I also participate in team meetings and continuous improvement discussions. A strong team dynamic promotes efficiency, reduces errors, and fosters a positive workplace culture, all of which ultimately benefit patient care. 18. How do you handle conflicts with coworkers or supervisors in the lab? When conflicts arise, I approach them calmly and professionally. I first try to understand the other person's perspective and clarify any miscommunications. I avoid confrontational behavior and focus on resolving the issue through respectful dialogue. If necessary, I schedule a private discussion to address a concern without disrupting lab operations. When problems persist, I involve a supervisor or human resources to mediate. I believe in constructive feedback and maintaining a collaborative environment. In one instance, I disagree with a colleague about test prioritization but resolved it by aligning on lab protocols and agreeing to communicate more clearly during high-volume periods. 19. Why did you choose to become a clinical lab technician? I chose to become a clinical lab technician because I have a passion for science, healthcare, and analytical work. I enjoy working behind the scenes to provide essential data that directly influences patient diagnosis and treatment. The role allows me to combine technical skills with precision and critical thinking. I'm also drawn to the fast-paced, ever-evolving nature of laboratory medicine. Making a difference in patient care, even without direct contact, is deeply rewarding. This career offers continuous learning and opportunities for advancement. Ultimately, I find fulfillment in knowing that my accuracy and attention to detail contribute to better health outcomes. 20. Where do you see yourself in your lab career in the next 5 years? In the next 5 years, I see myself advancing both technically and professionally within the clinical laboratory field. I plan to pursue additional certifications such as ASCP and possibly specialize in areas like molecular diagnostics or microbiology. I'm also interested in leadership roles, such as lead technician or lab supervisor, where I can mentor junior staff and contribute to quality improvement initiatives. Continuing education is important to me, so I may consider a degree in medical laboratory science or healthcare management. My goal is to grow within a dynamic laboratory environment while consistently supporting accurate diagnostics and patient care. Thank you for exploring the top 20 clinical lab technician interview questions and answers. We hope this guide boosts your confidence and readiness. Stay focused, keep learning, and approach your interview with professionalism. For more career tips and resources, don't forget to like, share, and subscribe to our channel.